Shalom and welcome to another exciting and informative episode of Homefront. We inside season 2 and I am joined by JP.
Yes, Robbie.
And today, JP, we have with us Professor Hutchinson, who is back on season 2. You know, he was great. A lot of people, you all asked about him. You all asked for him to come back on the show, and we are here. We have brought him back for season 2. Now, Professor is a professor in psychiatry.
Yes.
He is the head of department at the Eric Williams Medical Sciences Complex in psychiatry. So anything when it comes to psychiatry, this is the man. This is the man that we're talking to. So, Prof, welcome again.
Thank you. Nice
All
to
right.
be here.
Okay, Prof.
Great to have you. And we are now, I thought by the time we had season 2, we would have been talking about something different, JP.
I was hoping Zorro, Carnival, I'd say something.
Yeah, I thought this would have been a carnival show, but no, we are here. We are almost 20 months?
Yeah.
We're almost 2 years into this pandemic and ain't letting up anytime soon, right?
No.
So we analyzing it a bit. Last year, JP, we would have had the first surge probably around August, September.
Yeah.
And then 2021, we had another surge around April, May.
Yep.
And now it looks as though we're going to have a third surge.
Yep.
We're not sure, we're hoping not, but it seems likely because of the Delta variant being present.
Yeah.
And then in the first day of the pandemic, we would have now been kind of panicking as to what is happening.
Yep.
COVID-19, what is this thing? Everybody was buying all the toilet paper off the shelves. So we were still kind of grasping the reality of the pandemic. And then in the second year, we learned a lot more about the virus itself.
Yeah.
We learned a lot about the vaccines.
Yeah.
And then now we are in a stage where we have the vaccines. And now we are kind of encouraging people to get vaccinated, that sort of thing. So, Prof, I want to ask, from all of this information that we have, with the vaccine, we have less than 50% of our population that are vaccinated. Are you surprised by these numbers?
Not especially. I think that the point you made about the pandemic, I mean, I think for the society, it's a very difficult thing to consider and to take on board. And I think the idea of the vaccines, I think we initially touted as a solution.
Right.
And I think now it's clear that it's not a complete solution. And I mean, I think traditionally there's been a issue with trust in terms of the population and the medical services. So I think those two things put together would mean that the uptake would be, I think, less than optimum.
You mentioned the word trust, and I was telling JP before we started that I had a friend, and she was very, very hesitant about the vaccine, and she was mentioning that I asked her, I was like, why you didn't want to take it? And she said that she didn't trust the information. And I was like, okay, but wouldn't you be the same person that when you're sick, you would go to a doctor? And if you're sick and you go to a doctor and a doctor recommends these certain medications for you, wouldn't you usually trust that medication that the doctor would give you to get better? And she was like, yes. I was like, so why when the doctor comes now and recommends that you take a vaccine, that you don't trust the doctor's recommendation now? So is
the
it
same person who go to the hospitals also when they're sick with COVID to get the same treatment for COVID? So why now? Yeah, I agree.
Well, I mean, I think there's hesitancy about those things too. And I think the other factor that complicates the situation is the internet and social media. So whereas before you would go to a doctor and accept what he or she said, now you're going to check it on Google yourself. And because both the pandemic and the vaccine have been associated with so much, to the uninformed viewer, so much conflicting information, it becomes even more difficult to trust. And if it is consistent with your belief system, so if you have a belief system that is already kind of suspicious about science and about the effectiveness of some interventions, then the information or the negative information that's available would reinforce that and lead to the kind of hesitancy that we're seeing. And of course, in addition, across certainly in the developed world and perhaps in the developing world as well, there is this strong anti-vaccination movement that has developed all kinds of ways of communicating to the people who believe similarly. And I think it's created almost a kind of a group, a subgroup that holding on even more strongly to this idea that these vaccines are somehow, not to be trusted.
But do you think it's something like they just don't trust the vaccine, or do you think Trinis on the whole have trust issues? Because I asked her, I say, well, again, if you don't trust the doctor to recommend a vaccine, I sorry for your boyfriend. Well, can you tell him he fall asleep last night and he answered the phone?
Well,
he in trouble this morning.
Well, in fact, that's an interesting question, because Trinidad and Tobago is a low trust society, right. And it's anchored towards the lower end of the trust index, and that applies across the board to all institutions, including health institutions. So there is already a kind of lower threshold to distrust. And then we have the belief systems with regard to the supernatural and the spiritual and the bush medicine and the, all those things that also kind of influence that sense of detachment from, accepted medical science.
And then, well, in those, what you're speaking about, you have different groups. So you spoke about, you have the religious groups, and then you would have people who would believe in similar things. And this leads to something that JP was mentioning to me before, is where you have that theory of diffusion.
Yeah, there's this thing called, well, Prof, I know you heard about it, the law of diffusion innovation, where when you bring out something new, you have 5 groups. It's almost like a bell curve per se. The first ones are the innovators. They're the ones like the new iPhone, you can wait for a month, but they'll be the ones who'll be lining up to get the iPhone. They must get it now, first. And then you have the early adopters. There's the ones afterwards who, follow up. But afterwards, you have the early majority, and they're the ones who, as Prof was saying, they sync their belief system with, science, etc. They'll take it up. But you have the late majority who are the ones who are the skeptics, and they're like, you know what? I need to know more. I need to be convinced. I need to be wooed. And then, of course, the laggards who are lagging behind, they're the last one. And so my question is that I think we're in a stage of probably the late majority. We have skeptics right now. And the question I had for Prof is that, what do we do? How do we get that late majority population? How do we twist it? Now, as you said before, Rome, we're not about like saying vaccinate. We're saying here what we're having a conversation with. We're trying to get the information out there. The same thing Prof was saying, where people get the information from other areas. We're saying, if you trust Rome with his red T-shirt
and my nice smile, my trusting smile.
And if you trust, this show with we're bringing you props, we're trying to give you the information to make sure you make your own informed decision with our information. So my question, Prof, is that what can we do? What are the groups now with that late majority, those skeptics?
Since the pandemic began in March 2020, we have been taking cover and protecting ourselves using the regular and established protocols: washing hands, wearing masks, watching distance. We now have a grand opportunity to push back at the enemy through the use of vaccines. Vaccines will give us hope for reducing fear, anxiety, and resistance. They will allow us to assist the poor, the needy, and those who are vulnerable. Receive the vaccines as they are available. We are longing to return to worship, to pray, to sing, to give God thanks in a safe environment, and vaccines will allow that. I am fully vaccinated, and that allows me an extra layer of protection and confidence to do my work. I appeal to you. Receive the vaccines as they become available. Consider and respond positively. we must move on to normalcy. Let's do our part. Let's vaccinate TNT.
What groups are
well, I
there?
mean, I think the first thing to come to terms with is that it's not a uniform group.
Right.
I think there's several subgroups within that group. I think there's some people who are just afraid. There's some people, as you say, who need more information. There's some people who, because of religious reasons, don't want to take it. There's some people who disbelieve the science. There's some people who don't believe COVID exists. You know, so it's a wide range of groups. So I think that it certainly won't be a one-size-fits-all kind of strategy. But I think the overarching thing, and I think this is perhaps one of the issues that has emerged, is that I think a softer touch is likely to be more effective. I think the way it was put across, it sounded kind of coercive. It sounded kind of, you know, if you don't do this, you know, we are against you, we don't want you, you know, there's something wrong with you. And that kind of approach tends to make people feel even more defensive and more convinced that they're doing the right thing.
Right.
Particularly in the sense that, you know, the idea that the multitude might be going down the wrong road, and I am, you know, holding up for, you know, what is true and what is righteous, and all those things. So I think we have to be less coercive, more supportive, more understanding, more empathetic, and kind of encourage them from a more, I think, a perspective that suggests that this is really for the greater good.
Right.
You know, rather than a kind of, you know, you're trying to save yourself.
So you're saying it's almost like, going back to the first thing, Prof, you were saying that it's almost like the algorithm we speak about in social media, where once you believe this, then you get reinforced with that belief system all the time. So you're seeing that in our society, we have all these groups who are being reinforced with their information all the time, and they just having separate thoughts about it. So we don't have that cohesiveness of thought. It's just very separate groups.
Yes, definitely. And then there's the political divide as well. And I think that that political divide means that the government, being the agency that's pushing it, the people who are anti-government, will be ambivalent.
Sure.
So that's another dimension to it. So I think there are a lot of factors that have to be addressed in terms of reining people into
and
this.
as Prof says that, when I come back, because we're going to head across to the mindfulness minute, is that I have a whole other theory that I want Prof to be able to analyze for us. So breathe in, breathe out the negativity. We're heading to our mindfulness minute.
Hi, and welcome to our mindful moment. So what is mindfulness? Mindfulness is defined as the art of being fully present in this moment, of being here now. Very often in our busy lives, we're caught up in doing the next thing, or thinking about what's going to come next, or even remembering what's happened before. And we forget to be fully present in this moment where life happens. So over the next few moments, we're going to be practicing the art of just slowing things down and being fully present. I'd like to invite you to take a deep breath in and out with me. Just let go of the need to do, and we work on the act of fully being here. And to end our practice today, I'd like to invite you to take 2 deep breaths in and out. So we breathe in and out. Good. And one more time, in and out. Just be aware of the sensations around you, and just be here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED Cares Foundation. So we need you at home watching us to go donate, donate, donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You ready? On three, we go and say yeah. 1, 2, 3.
Yeah!
Yay! The PD Cares Foundation. So you can see that we are all a lot more relaxed, and we hope that you at home listening to us, looking at us right now on home front, feeling a bit calmer as we came back from our mindfulness moment. All right, so JP, we were talking about the theory, theory, right? Yes. So here's the theory, right, Prof? The theory is that some people are saying that they feel as though if they weren't being forced to take this vaccine, they would have quicker take it. Because some people are saying, well, you're telling me I have to take the vaccine? Well, there's no self I ain't taking this vaccine. And you mentioned a softer touch.
Yeah, you mentioned that, Prof. So just to challenge you a little bit, that's what the show is all about. I know I actually agree with that. I'm real spoiled child. If you tell me to do A, I will just do B, because I'm like, you can't tell me that, right? But if you, as a healthcare team, as a nation, the entire government, if they were faced with people dying, you have the national perspective, and you have you want to do the soft touch, but you want to also get the population to get into it as soon as possible. How do you marry that, though? How do you marry that soft and hard? What can we do?
Well, I mean, I think the thing about the forcing is that it reinforces the idea that there is an agenda. Why are you being so insistent that I have to do this? So I think that is one of the reasons that I think people kind of pull back from it. But I think in terms of how do you do it, I think there are a combination of ways. I think we have to emphasize a kind of more psychosocial approach. So it's not just a robotic kind of come in and get your vaccine, but there has to be some additional support, some make it into an event, make the idea of coming to get the vaccine something that people will look forward to, to kind of eliminate some of the fear and some of the suspicion. And I think it was in Toku they had gone to visit people, and I think that's also an approach that we haven't used enough. Going out to people, meeting them where they are, and kind of relating to them and talking to them and saying, okay, well, this is why we're here, this is what we've come to do. And if they refuse, say, well, we'll come back. We go down the road and we'll come back later in the week. And if, as they see their neighbors doing it, then again, they'll be more likely to go along.
The trust factor you spoke about,
know? So I think that those would be two strategies. But I think the theme or the philosophy behind any strategy has to be a kind of hand around your shoulder, let me kind of take you through this, rather than this is what you have to do and it's up to you to come and get it. And if you don't get it, this is your punishment.
So we have to, essentially, he's saying we have to romance the population. We have to take the population on for a first date. We have to woo them with some flowers and chocolates.
Yeah. and I think we like that kind of thing. Right, I think we like ritual. We like, turning things into more than just a thing.
Right.
And I think we have to
making it a cool thing or something that you want to go to and get your vaccine versus the big stick approach. Because I felt as though from a lot of the people I have heard saying that they're not going to take it, is they felt it was a big stick approach. Right. And as Prof said, they weren't sure if there's a hidden agenda behind this thing, or why are you forcing me to take this thing? Yeah. You're telling me it's a choice, but it doesn't seem like if I have a choice, because you're telling me to go to certain places, I have to take this thing. And then to go to work, I have to take this thing. And to do this, I have to take it. But you're not letting me get to choose. So I think with Prof, with this softer approach, maybe we could try to convince the population by giving them more information, and as he said, meeting them on the street or at their homes or where they hang out, and just more a ground approach
Conversations
versus
with.
yeah,
Conversations
where,
with,
where,
yeah.
where I think people can maybe come to everyone's level, the authorities come down,
Yeah.
versus you stand on a podium and
Yeah.
you're speaking down to somebody,
Yeah.
where you come down at everyone's level and you speak across.
Right.
Yes.
Which I understand it, but again, I'm here to challenge. But if you were in that, in terms of an authority, right, and you were faced with a failing here, a system where people were ICU beds, you know, we have no more beds, etc. Is there time though for a softer approach?
Well, I mean, I think what we've done so far is one of the reasons we're in that situation.
Right.
So I think that continuing to do it is not necessarily going to change. And I mean, we've had surgeries before, and I think most people would either know somebody who has had COVID and perhaps even known somebody who's been very ill or died.
And that hasn't changed anything.
And that hasn't changed.
Gotcha.
You know, in
Right.
fact, some people are arguing that, you know, the surgery we had this year was because of the vaccine.
Right.
You know, so
Okay.
so I think people will use, again, if their belief system is pointing them in a particular direction, they're going to use any information to support that
reinforces
belief
it.
system.
Right. Got you.
And I think that group dynamic is a strong one. You want to belong to the group that you've chosen to belong to.
So you're saying really, talk to the red man. That's what you're trying to say.
With that one, we will wrap up this episode, but we must bring Prof back again because we have to continue this discussion.
Of course, my red
we
man.
definitely have to. And the next time we have him here, we're going to have a very, very intriguing discussion because we want to find out in detail as to if there's a difference between the
Yes.
mindset of
Yeah.
someone who is not vaccinated and someone who is vaccinated.
Yes.
This has been another very entertaining, informative episode of Homefront, and we want to keep on encouraging you to donate to the PED Cares Foundation. So head across to their website, pedcares.org, and send some money, touch all of the pocket. Now, if all you want to see us for another season, you have to make sure you donate, and we're going to help the kids. My name is Rome. This is JP Professor Hutchinson. Thank you very much. This has been Homefront. Yeah, give it a hand. I want to hear your